Hi, I'd like to talk about the recent healthcare debate that's still going on. I can't believe it's still going on, but just a couple of misconceptions that people are having is, first of all, it did get 60 votes in the Senate, then went to the House, and the reconciliation process, which even President Bush has done twice for tax cuts that were uh, about $1 trillion, and those tax cuts were for nothing. I mean, they were just free money for the rich. And what we're getting here is, I mean, the US government spends money on a lot of things, like wars and all these unproductive things. But if you're spending about $100 billion a year, and it's not really being spent because there is a policy payment and it's all paid for, and you end up saving money in 10 years and 20 years, if you have a budget of 100 billion and you get to give health insurance to 95% of the American people, I don't see any argument in that. That's it. I mean, those are the facts. Those are the numbers. There should be no argument on any of these media news outlets that I'm seeing right now. And there's no debate about it. I mean, it's just logical sense. And as far as having a mandate, well, it's there is a hardship clause in there. So if the policy is more than, I think, 8% of your total income or something like that, then you don't have to pay for it. And I think the fine is about 2% of your income, or about something like that. So I mean, they've worked out all those details. Don't think it's just a blind mandate. I mean, there are other clauses in there which take into account your income, how much subsidy you're going to get to help you pay for your insurance, and stuff like that. Another thing is that there's a part in the bill which also states that the insurance companies have to tell you um, how much of the money you're paying them, the policy, the premium, how much of it is actually going into services and healthcare, and how much is their profit. I think it's about 85% of whatever you pay your premiums will have to go to your to healthcare and stuff like that, and anything that goes over that would have to be paid back to some of the uh, people taking out insurance. So that'll also keep a check on um, the enormous windfall, I mean profits that they've been making by offering less insurance at higher premiums and not really catering to the customers, but instead just looking at the bottom line and trying to make as big a profit as possible for corporate uh, health insurance companies. So I hope that clears a few things out, and I just don't see why they're still talking about it. I think it's a done deal. It's a good thing. It's a good bill for the people. It's a first step. It's not a perfect bill, and I think we should move on to more important domestic agendas. Thanks.